Hello, Mayhem Nation. Welcome to day 3 of our MayhemReady OnRamp program. As you're seeing, we're beginning to layer in a little bit more sophistication in how we address soft tissue restriction, how we use our position transfer exercises to make it easier for you to do all the skill transfer work and all the exercise and training that you like to do. But it's important that we have some benchmarks to be able to talk about these positions. So today, in the archetype language, we're introducing the pistol archetype. Now, the pistol archetype is important and it's difficult. We'd ideally like it if everyone could get into a pistol shape, but we're even less concerned that you can actually get in and out of a pistol shape doing an actual pistol. But when we talk about pistoling, what we're really talking about is, can I expose the ankle to its full ranges of dorsiflexion, and can I not hide some hip range of motion, and I have to have some hip flexion or knee come to the chest where the leg isn't out like a squat, but more along the lines of sort of closer to my midline. So the pistol archetype, let me show you, I'm gonna grab Diane Fu here. And again, if I had Diane begin a conversation about the pistol, I'd say, hey, can you put your feet together? And remember, our balance needs to be between the ball of the foot and the heel. So I'm gonna keep that 50-50 pressure. And then all I'm gonna say is, as you look down, Diane has her ankle nicely in the middle of the foot. And this is really important as we talk about ankle function. A lot of times people are chasing ankle function, they're chasing restoration of their ankle positioning, but they're doing it in a way that isn't quite congruent with how the joint works best. So for example, if Diane turns her feet out and then collapses her arches, this creates a mechanism in the ankle where it's actually impossible for her to have full dorsiflexion. So imagine that she was in a squat position, she just caught a heavy clean and knees came in. At some point, she's actually gonna run out of ankle room and she's gonna have to go around the ankle, which is one of the reasons the knee comes in or we come on the toe. And it doesn't matter what she does for that calf or that joint, as long as that joint force isn't what we call centrated or the joint isn't in a great position, she's not gonna have full access. So again, how do I know if I have full access? Well, we start with a foot together pistol. So this is just a 2-footed pistol. And ultimately, I'd like Diane to be able to go all the way to the ground. Go ahead. Keeping that pressure. And you can see that Diane can do it effortlessly, and she's able to do it with her knees together. So what we're really looking at is, can she bring her knee to her chest effectively? And can she do this without having to leave her heel come up off the ground, or disrupting her pressure between the ball of her foot and her heel? Now, if I ask Diane to kick one of her legs out into a pistol, she's able to do that and put that leg on the ground, you know, show off. But what really want you to see here is that this ankle orientation doesn't change. Can you switch feet for us? That in this bottom position, she's able to maintain the integrity of her arch, the ankle stays in the middle of the foot, and she's balanced between the ball of her foot and her heel. So this is just kind of our true test of finding out whether you have full ankle range of motion. Now, thank you, Di, come on back up. Again, can I do that foot together squat all the way down? Now, if I have Diane on her back again, and I show what I'm looking at, what we're trying to assess here is making sure that she doesn't have enough hip range of motion when she squats here. We're really looking at this range, which is how we assess hip range. So if I'm unable to flex the hip effectively, then likely I'm gonna have struggle and I'm gonna have to do a whole bunch of weird compensation to solve this problem, right? Or I'll fall over as I squat down. The second thing it forces us to do, flip on your stomach, is it forces us to actually look at the full range of motion of the ankle. So when I said keep her foot in the middle, that's what we call subtalar neutral, or just ankle in the middle of the foot. And in this position, she's gonna have the most runway in the joint to express dorsiflexion, or toes to knee, right, or toes to nose. But if that foot turns out, the arch collapse, we start to add a twist. Oftentimes, this is how athletes are trying to solve more problem or lack of range of motion in the ankle by turning the foot out and twisting. And you can see suddenly the Achilles doesn't quite work right. We end up with an impingement-like problem. The toe ends up being another ankle joint. And what we see in this position is that if I'm highly restricted, I will go around the problem, but in this position, this is like trying to walk through a doorway, but instead of hitting the doorway, you walk through the wall. We've got to have that ankle in that mid-range, which is one of the reasons why even in the lunge, we want pressure across and that foot running straight. Why we like feet a little bit straighter in the squat than maybe you're accustomed to, because we're trying to maintain the integrity of that ankle. Now, if I flip Diane back over again, today, we're going to introduce a couple of mobilizations around sort of more of thinking about the joint capsule. So we've talked about, hey, am I spending time with these end ranges of position? Is this a sliding surface problem or muscle dynamic problem? We've kind of talked about those things a little bit in the first 2 days. And today we're introducing our joint distraction concept. So the way the joint works is that the joint has a roll, slide, and a glide to it. So it's not just a perfect hinge joint. When we think about most joints, it's like there's a pin and then I just rotate. But we know that there's actually a lot of translation and a lot of rotation and a lot of coupled movements that happen with the joint simultaneously. So for example, as Diane's knee comes to her chest, the hip joint actually moves the opposite direction, just a little bit. Otherwise, she would always run in and we'd have this impingement or impinge happening, where we just have incomplete joint mechanics. But instead of looking at the limb, we're really trying to influence what's happening locally at the joint. And if you see a chiropractor or a physical therapist, this is one of the things she will be working on, is restoring your passive accessory motion, the motion inside the joints, not just what's going on with the limb affected by maybe stiffness in the soft tissues. So if the hip is going this direction and I need the hip to actually go that direction, the opposite direction of the limb, by adding a band that pushed here or pulled here, I might be able to encourage better motion outside in that joint. If Diane flipped on her stomach, for example, we call this the rough joint rule, and I was having her extend her leg, in this situation, even though it's the opposite, as the limb moves this way, the joint head, the head of her femur, needs to go this direction, which is why in a lot of our band distractions work on the front, we add in a load right here on the glute so that that hip can be encouraged to translate the other direction. So what we're trying to do when we work on adding a band to the system is simply seeing if we can upregulate the function of the hip. So let me give you a couple examples. Diane, come over here. We're set up here with a couple bands, and ultimately having bands does help if you have a capsule restriction. So the capsule can actually account for over 50% of the joint range of motion restriction. So it's important that it's on our radar. So simply, if I said, hey, Dad, step through that, put it up high up in your hip, facing away from the rack, and if I simply had her run forward and then hinge down, suddenly something that looked like downward dog, right, if she got into a downward dog position, we've got the band hooked and encouraging the movement of the hip in the correct direction, of sort of physiologically. So suddenly if she just bends the knee and straightens the knee, you're understanding that we're doing a simple band distraction. Now she may only feel this in her hamstrings, but that's not the tissue we're trying to encourage to move. So if I had her come back up and I had her rotate and face the rack suddenly and step back into a big lunge, same leg, remember the band is going in the opposite direction of the limb. So in this situation, we know, can she take a full breath in this position? Does she have access to her glutes, which is a sign that she's got control over this position? And now the band is encouraging her to move in this direction. So here she's doing some end range isometrics, but if she stood up and just did some lunges in this position, suddenly we're using a capsular bias in a lunge archetype, trying to encourage better motion closer to the hip versus soft tissue downstream. So this is our banded concept, and we can use bands for almost any of the joints in the body. And today I'm going to show you one for your ankle. So Diane comes out of that. We've got the band set up a little bit lower on the rack. And what I'm going to show you is our classic, let's go ahead and band that ankle and we'll face away, our classic banded ankle. And the idea here is that the band needs to go below her ankle bones here. So she set the band up below the malleolus. So that's the lateral malleolus and the medial malleolus. And she's trying to get the band as low as she can. And this band's a little fat, but that's fine. And the idea here is that that pins that foot down. The limb is going that direction. The band goes the other direction. So this would only work if her arch didn't collapse. So if she turned the foot out or let the arch collapse, suddenly we're just encouraging less effective mechanics. So we're always trying to mobilize into a joint positive position, a tissue positive position. We're never just stretching on tissues hoping they happen. We're always giving context. Now remember, our test retest with Diane was, can she get into a pistol position? Yes. Was she able to do that effectively and effortlessly? Yes. So maybe this isn't our most effective use of our time. Diane maybe doesn't need to spend a whole lot of time mobilizing her gorgeous ankles because my test retest was pretty simple. Instead, she may be better off doing some soft tissue work on her calves or a dressing. So go ahead and hop out of there. And then what I want to show you is something we simply call the bone saw. So what's going to happen is Diane's going to come down on her knees. She's going to stick this leg behind, and then she's going to put her other shin right in the calf. And what's nice now is that we're back to our systems approach. Hey, that ankle capsule didn't need a lot of work here. And now I'm introducing a concept we call short lever, long lever, which means Diane is working on her calf, but with the leg bent, which is very different than most of the time how we work on the calf. Most of us like to put our calf on the roller with the leg straight, but what that does is it works on the tissues in a long lever position. Sort of the difference between a hinge or a squat, right? If I'm hinging, that's a little bit more straight leg, and a squat is a little bit more bent leg. Well, the difference is that Diane is now working on a tissue system but thinking about what's going on in that limb. In this situation, she's just using her shin as a roller. Can she breathe? Is it painful? Can she contract, relax? Using all of the tools we've talked about, but in this situation, she's just slightly changing the bias of the system. So homework today is to give yourself a little bone saw. If you need an instep or a pad or a pillow here, you can do that. Even a friend's foot, go ahead and lift your foot up. And suddenly that just keeps her instep off the ground. She can use that shin all the way up to the knee in the back. Your job is to get 4 or 5 minutes, left side and right side, and then play around with a band. If you have one, you have access to that. See what that feels like. Get into a downward dog, put the band on your hip, get into a lunge, put a band on your hip, maybe try it on the ankle a little bit, but more importantly, test your pistol position. Most people know right away if they can get into a pistol or not. We're gonna start with that 2-footed, feet together, knee together pistol. Should be able to hit that shape, no problem. If there's something going on, let's see if we can get a little soft tissue work here. Notice we're in a pistol-like shape with the leg bent. This is not a pistol leg shape with the leg straight. Maybe add a joint distraction there, and you have successfully completed day 3 of our OnRamp. See you tomorrow.